Hello, my name is Megan. I'm going to be your nurse today. Is it okay if I perform a cardiovascular assessment on you?
Sure.
Okay, so the reason I'm going to be doing that is to identify any potential problems like high blood pressure or heart disease. So the objectives of a cardiovascular assessment are to voice valuable information and the function of your heart, okay? So this will allow me to identify anything abnormal to provide you the highest quality of care, okay? So what a cardiovascular assessment consists of is I will perform vital signs. So I'm going to go ahead and take your blood pressure and I will listen to it. So normal blood pressure is 120/80, okay? I would also listen to your heart rate. So normal heart rate is between 60 and 100. I also look at your pulse oximetry, which to determine the oxygenation within your body. A normal like SpO2 is between 90 and 100. And since you don't have a history of chronic obstructive pulmonary disease, I would like for it to stay between 90 and 100, okay? If you had that, it would probably be like less than 90. I would also, and get your temperature, okay? I do not have those tools with me today, so unfortunately I cannot obtain that information, but that's what I would normally do if I had those tools. So now I'm gonna go ahead and listen to your heart and your lungs. So with a cardiovascular assessment, we inspect, palpate, and auscultate. So kind of as I'm going through this with you, I'm looking at your skin to see if your skin is blue, making sure it's nice and pink. Your heart regulates blood through your body, so if it wasn't doing that properly, your skin could be like cool, clammy, it could be blue looking, stuff like that. But your skin is warm. Is it okay if I touch you? It's warm and dry, and you definitely have a nice color to your skin. So I'm also going to go ahead and palpate your pulses just to make sure you have strong pulses and the blood that's going through your body is nice and strong, okay? So if you could just hold your wrists out for me. Okay, and I'm gonna touch you. All right, you have nice and strong pulses. All right, and I would normally also look, feel your pedal pulses, which are on your feet, but because of the video, we're not gonna do that. And now I will go ahead and auscultate. So I'm just gonna listen to your heart, okay? All right, so your heart sounds good. I hear the lub-dub. I don't hear any murmurs or anything like that. It sounds nice and clear. So now we're gonna move on to some new assessment techniques regarding the cardiovascular symptoms. Regarding the cardiovascular system, I'm sorry. So the first one is going to identify any symptoms cardiac related. So the purpose of that is if you're currently experiencing any cardiac symptoms, we can kind of go into more in-depth testing and stuff like that to see if there is any kind of diagnosis that you have going on cardiac-wise. So subjectively, are you currently experiencing any chest pain?
No.
Shortness of breath?
No.
Do you feel like you're having any swelling in your body? Do you feel puffy? Okay. And do you feel fatigued at all?
No.
Okay. So because of her answers to those questions, she subjectively sounds like she is cardiacally okay. That's a word. The next new assessment approach is to identify any edema. So identifying edema with cardiac patients is very, very important because sometimes the heart is unable to properly function with fluid. The heart is unable to pump the fluid throughout the body, so swelling can unfortunately occur with cardiac patients. So when the body has edema, it indicates fluid overload, which in other words means the heart's not pumping as it should. So assessing for edema is normally, if you just want to put your hands up here. So since the video isn't allowing me to look at her feet, we'll just look at her hands. So if the patient had edema in some sort of way, if I press my finger down, it could be pitting. So if you put the camera closer, so if I press down, she has good capillary refill. Her skin color returns in less than 3 seconds. And also when I press, her skin automatically rises. If she has swelling, her skin wouldn't automatically come back up like that. And patients can also feel when they have swelling in the body. They can feel puffy, like their cheeks are puffier and stuff like that. And does your skin feel tight at all?
No.
And are you experiencing any shortness of breath?
No.
Okay, so as far as edema-wise, this patient in this cardiovascular part of the assessment does not have any edema. And the new third approach is I'm going to look for jugular vein distension. So the purpose of this assessment is because it is a key symptom of heart failure or any other heart or circulatory problems. So if you just put your head to just turn it. Yep, so if you look right here, you do not see the vein popping out at all. You just kind of see her neck muscle. Normally, if a patient with heart failure had jugular vein distension, it would be bulging. And that kind of indicates that fluid overload as well. So just a recap of kind of what we went over today. System assessments are a very important nursing aspect as they are focused. In general, with a head-to-toe assessment, something may be easily missed versus when you do like a cardiac assessment, we can pinpoint certain symptoms and kind of go from there. So the new assessment techniques I used help improve system evaluation. So they provide a more accurate way of measuring learning and encourage engagement, and it can help us acknowledge any kind of learning gaps as well. Strengths and weaknesses are identified, interventions are tailored to specific needs, and ultimately the patient is receiving the highest quality of care when you do the specific assessment techniques. All right, and do you have any questions for me today?
No.
Okay, thank you for participating.
You're welcome.
Mm-hmm.